Hi, I'm Ben Ruthier, and today I will be presenting to you the 2-minute step test. Now, the 2-minute step test purpose is to evaluate aerobic capacity and the degree of functional fitness in the older adult. It also can be utilized as a measure for independence functionally. In order to do this test, you need to have a ruler of some sorts, and you must have tape for measuring sake. So the first part of this test, how we set it up, is we have to get kind of the point where we want the patient's knee to clear in the step test. This point is a spot between the top of the iliac crest and the midline of the patella. Now I'm going to ask the patient, could you turn over, and is it all right if, turn this way for me, and is it all right if I feel around your hip to get a point where I can measure off of?
Yeah.
Okay. Alright. Find the iliac crest, and then go halfway between that and the patella. And I got 19 and a half. And I'm gonna go half of that, which will get us halfway to the, between both, about 9.75. Right there. I'm gonna put a piece of tape. Sorry if I put a little piece of tape here.
Go for it.
All right. I'm gonna have the patient stand next to the wall with that leg, the left leg leading, so I can mark a spot on the wall. If you lean up here. Now I'm gonna have a really big piece of tape here just in case the patient steps out of the frame when they're marching. You're good. Could you stand back up there again? All right, that's good. Now you also need a timer for the 2 minutes. And really the important part of this is making sure the patient's safe and that they're not unstable at all. So I'll be staying right next to him. I'll also be checking to make sure that his knee is clearing the tape. And I can't count any of the reps where his knee is not going above the tape. And when I'm counting the right step hitting the tape line. So he's gonna march in place, but each time the right step is above the line, then I'll count that. And I'll stand there and make sure I'm watching him. And basically, I'm gonna start the timer here. So when I say go, you're gonna start with your right knee, and you're gonna go up to the tape line, okay? Okay. Ready, set, go. 3, 4, 5, 7, 8, 9, 11. Okay, I'm gonna have 17, so step higher, try to get up to the tape. I can't count. 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 1, 2, 3, 4, 5, 6, 7, 8. Are you feeling all right so far?
Yep.
Okay. 40. 1, 2, 3,
More timer than I
Four.
thought.
5, 6, 7, 8, 9, 60. 1, 2, 3, 4, 5, So the patient in this situation had 74 steps in the 2-minute time period. Basically, if you're over the age of 60, it's suggested that you can get over 104 steps in the 2-minute time period. So I would educate the patient on what this means. So Jacob, you weren't above the threshold for your age. So basically, we're gonna have to work on that. We're gonna have to work on your endurance and try to get you up to that, and it's gonna make you a little bit more independent in your everyday life. Okay?
Okay.
Some other things to note about the 2-minute step test are that you can use a assistive device, a table, a wall, if there's any poor balance or stability during the test. Just make sure you document it. And really, the step count may differentiate between the gender of the patient, whether they be male or female. Males usually have higher step count numbers. And the cutoff scores for predicting independence from ages 60 to 64 is 106 for males, 106 steps, 97 for females. From 65 to 69, it's 101 for males and 93 for females. And then from 70 to 74, it's 95 for males, 89 for females. 75 to 79, it's 88 for males, 84 for females. 80 to 84, it's 80 for males, 78 for females. And then 85 to 89, it's 71 for males and 70 for females. And at 90 to 94, it's only 60 for both. Now, it's important to consider about the 2-minute step test is that it has great or excellent correlation and concurrent validity between the 2-minute step test and the 1-mile walk time, and also time on the treadmill to 85% heart rate, which is important to know because the 2-minute step test could be a shorter test and easier to administer than those two tests. And there's also adequate correlation between the 2-minute step test and the Berg balance and the Tinetti. And it also has adequate correlation between the 2-minute step test and physical frailty when controlling for education levels. One final thing to know about or note about the 2-minute step test is that it has a high predictive validity between fallers and non-fallers concurrently with a Berg balance test. Now, 50 steps on the 2-minute step test has an odds ratio of 11.59 for scoring less than 8.12 seconds on the single leg eyes open component of the Berg balance test. Now, what this tells us is basically that this item of the test in the Berg balance works concurrently or can be related to the 2-minute step test in predicting fall risk.